Luanda. I'm a clinical oncologist. That means I'm a doctor who treats cancer using chemotherapy and radiotherapy. Today we're going to talk about liver cancer. So when we talk about the liver, one, it's the largest solid organ. It's almost the size, you can compare it to a football. It has many functions. One, to regulate blood sugar, because all the blood from the stomach and the intestines passes through the liver. Two, it also has a role in removing toxins from the body. Three, it also has a role in ensuring clotting of blood. Some of the clotting factors are made. It also has many other functions. So today we are going to focus on what liver cancer is. So being a solid organ, it can get cancer. The most common cancer that the liver can get is called hepatocellular carcinoma. It starts from, the liver has different cells. Part of the cells, one of them is called a hepatocyte. So when that cell becomes cancerous, now it forms a growth, a combination of cells that are abnormal, which is what is called hepatocellular carcinoma. There are many ways to make a diagnosis of hepatocellular carcinoma. One can be the blood test. If there is cancer of the liver, then the function of the liver will be deranged. So if you do a blood test, you'll notice that the figures are not very okay. Two, you can do imaging. Imaging in this situation, we talk about CT scan or an MRI. And when you do the different phases, like the portovenous phase, it can be able to show you the different changes of the mass, how it looks, and the radiologist can be able to make a clinical diagnosis from the imaging. There are times we really need to confirm whether the cancer that we are seeing in the liver, is it originating from the liver, or did it start somewhere else and come to the liver? So in that situation, we need to do a biopsy. What's a biopsy? Biopsy means taking a small piece of that tumor and looking at it under the microscope. So the biopsy can be done using imaging, meaning we can use an ultrasound to notice where the tumor is and take a sample. We can also use a CT scan to do the biopsy. Most of the time that's done by an interventional radiologist. That is a doctor who specialized in taking biopsies using the machines like an ultrasound, a CT scan, or an MRI. Once a sample has been taken, a pathologist is able to examine it through the microscope and later on subject it to a number of tests to confirm, is it primarily from the liver or did it come from somewhere else? So when we talk about cancers that we see in the liver, it is more common to get cancers maybe of the breast, of the colon, coming from somewhere else and eventually coming to the liver, as opposed to primarily cancer coming from the liver. So what are some of the signs of cancer of the liver? One, you may notice that you're having weight loss. We discussed the position where the liver is. It's about the size of the football. It's the largest solid organ. It is more on the right side. So having pain or discomfort on the right side just below your ribs might be a sign that you have liver cancer. You might also notice you have appetite loss. But one of the significant features can be the yellowing of the eyes. You notice that your eyes, the part that is normally white, becomes yellow. The urine can also become more yellow. Why? The yellow is because of retention of bilirubin. So bilirubin is the yellowness. So once the liver is not able to clear it or remove it, you have accumulation of bilirubin, and that can cause yellowing of the eyes. So that can be a symptom. You can also notice that the stool, when you go to the washroom, you notice your stools are lighter in color, chalky in color, and the urine is deep yellow. Just the yellowing we're talking about that is in the eye, you also notice your urine has a lot of that. Some develop a lot of itchiness because of that, the same thing, bilirubin accumulation. Those can be some of the signs and symptoms. Unfortunately, when the disease is very early, remember the liver is a very big organ. We've said it's the largest solid organ. Early disease, you may have no symptoms, so it's important to know. So who are at risk of getting liver cancer? Most of the time, the most people who are at risk are those who have chronic liver infection. For example, if you've had hepatitis infection, either B or hepatitis C, that's a risk factor to getting liver cancer. Number 3, exposure to aflatoxins. That is in maybe the maize, can also be a risk factor to getting liver cancer. Another thing that's a risk factor is alcohol. alcohol. I know you're looking at me. Yes, alcohol. When you take a lot of alcohol, it's broken down within the liver, and that strains the liver. Over time, you notice that the liver becomes fibrous. It becomes like it has strings or streaks or hard things within it. If you have eaten liver, then possibly you've noticed sometimes there are hard things within liver. So that is the same thing that happens to our bodies. When you take a lot of alcohol, your liver, instead of it being soft and supple, it develops fibers within it. And that is what cirrhosis is. So it shrinks in size and also becomes fibrous. So those who've taken a lot of alcohol and have liver cirrhosis are at risk of getting liver cancer. So how do we treat? So once we've confirmed that you have liver cancer, cancer that began within the liver, there are many ways that treatment can be done. One is surgery, where we remove the cancerous bit. The liver is a very beautiful organ because it's able to regenerate. You can remove a chunk of it, but it will be able to regenerate and almost grow back to its original shape and size. So surgery is number one. Two, we can do what is called heating and cooling, where we go to the liver and we expose it to heat and cooling. We call that ablation. And that ablation is able to kill the cancer cells in that region. We can also give chemotherapy, both to the liver itself or systemic through the bloodstream, and eventually it will get to the liver and deal with those cells. The other thing we can be able to do is radiation. We're able to give radiotherapy to the liver. If we notice the cancerous area, we can give radiation to that area. Then there are also clinical trials that are present where new novel treatment agents are being discovered and tried on patients. There are also tablets that are in the form of chemotherapy or targeted therapy that can deal with the cancer itself. Targeted therapy is different from chemotherapy. Chemotherapy targets a whole bunch of rapidly dividing cells. So it will target your hair, it will target your mucous membranes in your mouth, it will target your nails, because all those are rapidly dividing cells. However, for targeted therapy, it looks at the cell, the cancer cell itself. On its surface, what does it have? What is unique about that cancer cell? So that when we give you a treatment that comes in, it is targeting that cancer cell itself, meaning it reduces the side effect profile but has the maximal impact on the cancer itself. So as we talk about liver cancer, it's important to note that there are cancers that start with the liver, within the liver, and then there are cancers that begin somewhere else. For example, a patient might have cancer of the breast, but because of how the disease has progressed, you see the same disease now in the liver. That means it's breast cancer, but it has metastasized. It has gone to the liver. So it is not liver cancer. It is now breast cancer that has gone to the liver. When a disease has left the organ it originated from, for example, it started in the breast, now it's in the liver, it's gone to the brain, it's gone to the lungs, then we call that metastatic disease. And that is what stage 4 disease means. It means disease has left the organ it began to and has gone to a different organ. The liver is one of the organs, it's the largest organ. Most of the blood circulation goes through the liver, especially from the stomach and the intestine. So the liver is one of the common places where we will have metastasis. We will have cancer leaving one area and heading to the liver. However, the naming becomes different. We name it where it came from. So liver cancer means cancer that began in the liver, whereas if it came from anywhere else, we call it metastatic.